Report to the Board, Human Resources Priorities in 2025. University of Maryland, University College. By Group 1, which included Ayira Inamaroma, Janine Gash, Anai Johnson, Karen Metallo, Grace Bew. This presentation will be educating us on core macro trends that will require the adoption of 5 emerging health professions. In order to infuse a patient-centered agenda, it is vital to anticipate healthcare trends that will influence organizational culture and factors such as political climates, technological advancements, healthcare cost, and community-based needs that actively affect our human resource practices and future targets. Providing this data will help our Human Resource Committee to enhance their ability to identify, recruit, and retain the appropriate skill mix for the organization. The United States has the most expensive healthcare system in the world, spending over $3 trillion in 2015. About 5% of the United States population accounts for 50% of the cost of healthcare. The United States must continue to improve its ability to improve our ability to manage both high-cost patients and rising-risk patients and focus on keeping healthy people healthy. Healthcare benefit delivery is being transformed as a result of the evolution with the economic, demographic, personal lifestyle and behavior, technology and government policy sectors of healthcare. Trends in the changing United States demographic. By the year 2030, 1 in every 5 Americans will be elderly, with the number of those aged 65 or older doubling from 35 million in 2000 to 71.5 million. Where will they go or live? This graph demonstrates the changes in the number of people over 65 years old. In order to provide healthcare for this growing patient population, healthcare providers need to raise awareness and provide age-friendly initiatives for seniors in our communities. It is important for the United States to establish affordable accommodations for the increasing elderly population. Human resources will need to pay attention to meeting the needs of the growing elderly patient population. By 2020, there should be a creation of over 761,000 new nursing and residential facilities jobs. Assisted living facilities will need healthcare administrators, physicians, healthcare informatics, and human resource managers to ensure the smooth running of these facilities. Trends in technology, telehealth applications. The American Telemedicine Association, ATA, defines telehealth as the use of medical information exchanged from one site to another via electronic communication to improve a patient's clinical health status. Real-time can be used to consult, diagnose and treat patients. Telehealth has been around for about 20 years, and it is estimated that 15 million Americans receive remote medical care per year, and number continues to grow. An example of telehealth is telepsychiatry. Telepsychiatry is a virtual communication method. Behavioral health services can be conducted through wireless technologies in patients' home and anywhere outside of a medical facility with the use of Wi-Fi, which makes it a valuable tool for first responders to prevent harmful situations. This services will better diagnose behavioral health disorders, and the number of specialists is emerging. A second example of telehealth is telesurgery. Includes computer-assisted consultation and surgery, the assistance of video and audio transmission. Career opportunities in telehealth include telehealth managers, who will oversee the operations of these practices. A telehealth manager must be able to analyze, troubleshoot and optimize existing telehealth applications, as well as lead research efforts on telehealth policies and create new telehealth policies. In addition, skills in developing marketing content for new programs and training of new telehealth providers and administrative staff. Trends in healthcare science include biotechnology. Biotechnology is the manipulation of living organisms through genetic engineering and can be used to find applications in genetic testing and pharmaceutical drug discovery and production. Some uses for biotechnology include finding genetic disease in unborn babies, finding out if people have a gene for a disease that might be passed on to their children, screening embryos for diseases, and testing for genetic disease in adults before they cause symptoms. Career opportunities in biotechnology include a Biotechnology Healthcare Administrator who has a good knowledge of biotechnology and its applications. A biotechnology healthcare administrator may require individuals with a Master of Business Administration and with a dual specialization of biotechnology and healthcare administration. Trends and increased use of data analytics through advanced clinical decision support. The rapid implementation and adoption of computer systems in healthcare operations allow for data in electronic health records and claims data to be used for clinical decision-making at the bedside. Some examples of advanced clinical decision support are optimizing pharmaceutical outcomes and clinical decision support for advanced medical imaging studies. Different areas of expertise are needed which could be brought together as a team of analysts within the healthcare organization. A data analyst needs to have expertise in using different sources of data. Clinical expertise is needed to support and develop predictors and outcome variables, interpret results, and deploy solutions while managing a shift of resources from manual processes to software solutions. A computer scientist with capabilities in programming languages may also be needed to develop further advanced modeling. Finally, a system administrator may be valuable to create and maintain technical infrastructure. Trends and increased healthcare cost. Healthcare deficit continues to climb due to wasted resources, unreasonable insurance markets, and government mandates that are not easily controlled. This can be resolved by focusing on value-based care, which concentrates on the quality of services provided to patients rather than the quantity. Career opportunities for addressing increased healthcare costs includes hiring and maintaining a healthcare statisticians who can effectively monitor financial and resource management. Healthcare organizations need to invest in a technology-focused framework to assist in identifying and managing a changing and aging patient population, map and track care through improved clinical care processes and standards for disease management, use clinical decision support systems in the primary care milieu, and continue to coordinate cross-continuum care despite the political climate. Any questions?